Despite tremendous advances since the discovery of insulin almost 100 years ago, the management of type 1 diabetes remains challenging. The majority of type 1 diabetic patients do not have healthy body weight, and many have hypertension or inadequate controls of blood lipids. Regular exercise can help. It diminishes the risk of having heart disease, reduces glycated hemoglobin, improves blood vessel health, and cardiorespiratory fitness. Yes, it makes you healthier overall. But being type 1 diabetic and doing enough exercise is not an easy task. Several barriers to exercise might exist, including fear of hypoglycemia, low blood glucose levels, loss of glycemic control, insufficient access to facilities, time, motivation, or just knowledge around exercise management. Hi there, this is Dr. Borja Bandera, and today we are gonna talk about exercise and type 1 diabetes. If you want to know the very latest scientific recommendations and available strategies that help incorporate exercise safely into your daily life, don't miss this video. And if you are new in this channel, thanks for subscribing. It means a lot and helps us create more and better content. All scientific recommendations given in this video are summarized in this international consensus about diabetes and exercise. You will find it in the description below. First thing to consider before to start exercising is check your glycemia sometimes before exercise to assess the trend in glucose concentration. We want to know if it's stable, going up or going down. All diabetic patients should carry with him a fast-acting carbohydrate source like a glucose gel or fruit juice, and a slow-acting carbohydrate source like fruit or biscuits. On top of that, you will carry your glucose level monitor and proper hydration source. Now let's start with the recommendations. If your glucose levels are less than 5 mmol per liter before starting exercise, ingest 10 to 20 grams of glucose before beginning. Delay exercise and the blood glucose is more than 5 millimoles, and monitor closely for hypoglycemia. If before you start glucose levels are near target, let's say 5 to 6.9 millimoles, ingest 10 grams of glucose before starting aerobic exercise like jogging or cycling, since this kind of exercise tend to lower glucose concentration. Anaerobic and high-intensity interval training exercise can be started since they tend to increase glycemia instead of lowering it. If you are on target levels between 7 and 15 millimoles, congratulations, you can start both aerobic and anaerobic exercise. But remain vigilant because anaerobic activities could raise glycemia even more. If you are above target with more than 15 millimoles and hyperglycemia is not justified, maybe you ate less than an hour ago, it's time to check blood ketones. If they are less than 1.5 millimoles, exercise should be restricted to a light intensity for only a duration of less than 30 minutes, and a small corrective insulin dose might be needed before starting to exercise. If blood ketones are higher than 1.5 millimoles, exercise is contraindicated and glucose management should be initiated rapidly. Remember that exercise in general, and more frequently aerobic exercise, increases the risk of delayed hypoglycemia, so stay vigilant even until 12 hours after exercise. Retain this: exercise is one of the best therapies in both type 1 and type 2 diabetes, but some knowledge about exercise physiology, hypoglycemia and diabetes is needed in order to keep you safe. If you want more health empowering videos, don't forget to subscribe. See you soon, stay healthy and strong.